video, I'm going to explain what EMDR is, or eye movement desensitization reprocessing. It's basically a form of psychotherapy that has been developed for trauma. Now, it's a little bit controversial, with some critics citing their concerns over the quality of the evidence, but I'll tell you a little bit more about that in a moment. It's a treatment specifically for post-traumatic stress disorder, or PTSD, and if you'd like to know a little bit more about that, you can watch my video, What is PTSD? But very briefly, PTSD is where the brain doesn't process a traumatic event in a normal way, so the memory is stored differently and continues to intrude on your awareness a long time after the event is over. And what EMDR does is it helps you to reprocess that memory so it's stored properly. It does this by, in your session, helping you to recall the experience whilst experiencing something called bilateral stimulation, which is basically a rhythmic side-to-side pattern. And this can be visual, so it can be your therapist moving their finger from side to side. It can be tactile, so tapping the table from side to side, or it can be auditory. So sometimes your therapist will use speakers that will emit a noise in your left ear, your right ear, in your left ear, in your right ear. Now, how it works, we're not completely sure. There's a couple of ideas. One idea is that this sort of dual action, so doing two things at once, elicits this mind state or mental state that's a little bit like REM sleep, which is the type of sleep that we're in when we're processing memories. The other idea is that our working memory has quite a limited capacity. So if we're multitasking when we're recalling the details of our trauma, we recall less, or the information that we recall is limited, which means the emotions that we remember will be less intense. Anyway, those are the two ideas, hypotheses on how this works or why this works. EMDR is different from the other treatment for PTSD that has been shown to be effective, trauma-focused CBT, in a number of ways. You're required to give a less detailed description. You don't directly challenge any of your beliefs. There's no extended exposure and there's no homework, so there's nothing to do in between sessions, which is all good, apart from the fact that the evidence base isn't as robust as it is for the other treatment, trauma-focused CBT. If you'd like to know more about that treatment, I have a video on that as well. I think it's under What is the best treatment for PTSD? Now, this isn't to say that there isn't any evidence for EMDR. There is. However, a recent review has shown that there is a significant researcher bias, which is basically that the people looking into whether or not EMDR was effective aren't completely objective. They're not neutral. They're invested in finding out that this treatment works. In terms of my recommendations for what you should do, EMDR is certainly a less intense and challenging treatment for PTSD, so it's worth a try because there is some evidence there. There's evidence that it's better than doing nothing, and the results could be similar to trauma-focused CBT. If it doesn't work, you can then also try trauma-focused CBT because the evidence base for that treatment is far more robust. Okay, I hope this was helpful. Thank you for watching, and I will see you soon.